All right, just whenever? All right, my name is Grant Dickerson, the specialist. I'm a part of 277 FA, 2nd Striker Brigade Combat Team. I was down here on the border mission and drank something cold, went to the doctor, the dentist, and then they did an x-ray on my teeth.
Grant came in here with a referral from the dentist asking to evaluate unusual dark lesion that's seen on the x-ray. Immediately, we took another imaging in the clinic called the CBCT, which is a three-dimensional CT scan, essentially. And we saw a very large expansile pathology or growing tumor.
As a mom, when I heard the word tumor, I was just in shock. I think I was just scared and afraid that it could be cancer.
First reactions, of course, everybody always goes worst case. But we worried and we just said, let's work through the process, see where we end up.
What Grant had is something called a central giant cell granuloma. So a non-cancerous tumor in his lower jaw. It forms within the bone and then grows. It destroyed 2/3 of his mandible or lower jaw. So from a readiness perspective, if Grant would have been hit in the face at all, he would have probably broken his jaw. Somebody can come in with an oral cancer, a benign tumor, facial trauma, a congenital anomaly, some type of pathology or change to the upper jaw or lower jaw. Traditionally, that would entail the upper or lower jaw being removed and then possibly a transplant from the leg bone or another source to rebuild the upper or lower jaw.
This procedure would not have been all done in one day. They might have part of the surgery done today and then might not get teeth for 18 months to 2 years later.
Jaw in a day, as I say to my 5- and 7-year-old little girls, is when we take the leg bone and put it in the face bone. Really, the big difference between jaw in a day and traditional reconstruction in the US and globally is that you get your dental rehabilitation immediately. So the bone, the teeth, and your function, so your speech and swallowing, all come back that same day. So it takes 2 years of treatment into 1 day.
The primary goal for number one for patient Dickerson was a return to duty. He wanted to continue to serve his country and he wanted to return to the job that he had left behind in Fort Carson. And so after a long discussion, we consented him for the one surgery to restore everything.
Today, my role really started before the surgery, before the patient was ever on the operating table itself.
All the pre-op appointments, all the planning was done virtually on video communication.
We're able to gather intraoral photos, intraoral scans of the patient's teeth, as well as a CBCT for the patient. And using that information, we can actually virtually plan the surgery, the implants, and the teeth before the patient ever comes into the OR.
Reconstruction has a couple of phases. Phase one is you prepare the tissue to bring up to the head and neck. So we call that the harvest. So for instance, in the leg, we'll prepare the fibula, making an incision on the leg, isolating the part of the bone that we want to move, making the cuts so it's totally mobilized. So that's all the harvest. The next step is rebuilding it into what it's going to look like. So for a fibula, we'll actually make all of the bone cuts in the leg and rebuild it into the shape of a jaw before we bring it up to the head and neck. The next step is the inset, and that's where we take our rebuilt jaw and we use metal plates to connect it to the patient's mouth so that it fits in place. If we bring up skin, that also may be sewing the skin in to rebuild the defect. And then finally, we do the microvascular anastomosis, which means we connect the blood vessels together with tiny little sutures under a microscope. So all those are different phases of reconstruction, and they're sort of done in sequence.
Reconstructive success is finite. I did a procedure, I got a good outcome, patient okay, moving on. You can see how it creates silos. But if your outcome is longitudinal in process, and it is as audacious as restoring the overall health of a patient, Rather than myopic of one procedure, that is how we restore form, function, and purpose.
It's more than just plugging a hole or closing a wound. We really do need to restore all of these very complex functions. So it's more than removing the cancer and telling them that they're cancer-free. The goal is to be able to tell them they're cancer-free and that they're going to be able to eat, or that they're not going to drool the rest of their life, or that they can speak to their loved one.
The focus is not the procedure. The focus is the patient. That's the difference between reconstruction, a single finite outcome, and restoration, which is a comprehensive restoration of one's health, especially for our warfighters so they can get back in the fight.
So as much as I would like to do it here, it takes a surgeon who has a specialized training in doing microvascular surgery. And it also requires the support staff to be knowledgeable and to be able to manage a patient like that after the surgery, in recovery, in the ICU, monitoring the health of the flap, and etc. So ultimately, I chose to refer the patient out.
He reached out and did the biopsy and did the initial workup, and we worked as a team between the team in Colorado and the team in San Diego. We actually were able to be so collaborative between the Army and the Navy and the entire military health system that we did all the planning, all the virtual surgical planning, all the fabrication of the 3D printed titanium and guides, all before Grant even showed up.
The fact that we are now able to work between Army, Air Force, Navy, that's all part of the Defense Health Agency, and I think that's good for us surgeons and doctors to be able to take care of patients.
My hope for Grant with this jaw-in-a-day surgery is that he keeps going with his career. He wants nothing more than to be in the Army, to be a soldier.
The soldier aspect of it for Grant, it's what he's always wanted.
The fact that Grant, after 30 days following his surgery, is able to function at this level and to be able to speak and walk, I think is amazing. Yeah, I have no doubt that he's gonna fully recover in a short amount of time and be able to do the job that he loves.
A diagnosis of a benign tumor and removing 2/3 of someone's lower jaw is a devastating diagnosis. There's no way to get around that. But our hope for our team is that his diagnosis, his experience, his recovery is just a chapter in his life and not his story. What the future holds for Grant is limitless.
He'll do amazing.